Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Today we'll be talking about vision and eye care, the importance of it. And joining me on the program are Dr. Celeste Hines and Dr. Janelle Kanai. Welcome to the program, Dr. Kanai and Dr. Hines.
Thank you for having us.
So World Sight Day was observed on October 12th under the theme Love Your Eyes. So to begin the program today, could we talk a little bit about that theme? What does it mean?
Well, as you know, World Sight Day is something globally, worldwide. It's observed the second Thursday of the month of October. So this year it was held on the 12th of October. The theme changes every year. This year's theme, it deals with eye care at your workplace. So that's one important topic because we all work, whether you...
Yes.
Depending on whatever work you do, you always need your eye. You need to take care of your eyes.
Definitely. Right? Could you tell us about some of the activities that you guys had during that period?
So we had daily screening of our employees at Georgetown Public Hospital. We are from Georgetown Public Hospital at the ophthalmology department. Daily screening for all employees. We also had some outreaches in various outposts, correct? Right? Mm-hmm. And yeah, basically that. So with the screening, we examine the eye completely,
yes.
Do the vision, check the eyes, check the eye pressure, check the back of the eye.
How does your department function on a day-to-day basis, Dr. Hines?
Well, if anybody's ever been to the eye clinic, you know that it's one of the busiest clinics at Georgetown Hospital. And on a daily basis, we see quite a few patients. So usually the basic workup goes like you come in, you have your vision taken. So we check to see how well you're seeing at a certain distance. Then we go ahead and test your eye pressure, which is very critical, especially for screening for glaucoma and some other eye diseases. So we do that, and then the patient is taken in to see the doctor. We have a screening room or a triage room where we would see like walk-in patients with emergencies. And then we have specialist consultation rooms where the specialists will see patients that have more complicated issues, patients that we're following up, post-op patients, patients that need special examinations and special tests done. So we would do that there.
What is the process like to join the clinic there at GPHC?
Well, it's not very complicated. Being a specialty clinic, we try to have patients referred from their either general physician, but because we're an eye facility too, and there are many opticals in Guyana, we do encourage patients to visit the local opticals in their area, and from the optical, their optometrist or refractionist will refer them to us too. But we do take walk-ins, urgent patients. Mm-hmm. We can triage that and decide, okay, can we take that patient today, or maybe we just give you a date to come back in a week or two.
Okay, could you tell us a little bit about some of those strategies that the Ministry of Health would have implemented to support eye and vision care across all regions of Guyana?
Well, that is a good question. So we have quite a few clinics, the satellite clinics from the Georgetown Hospital, I'd say. We have screening programs for diabetic retinopathy at those clinics. So we have a diabetic retinopathy screening clinic based at Georgetown Hospital. Then we have the Enmore Hospital has a system also set up. So patients with diabetic retinopathy can go there and have their eyes screened. We take pictures at that facility. We have optometrists on site. And then, of course, at different hospitals, they do have optometrists stationed there. And we do regular outreach programs. And then, of course, there is the ophthalmology hospital at Port Morant. So I think it's a collaborative effort to get, to have eye care dispersed throughout the country.
Definitely.
But for sure, we do need more. We need more doctors. We need more optometrists, more nurses that want to specialize in the field. So yes, it's a challenge, but yeah, we do need more.
Thank you so much, Dr. Hines. We're on the theme of love your eyes. Could you tell us, Dr. Kanai, how important it is for persons to take good care of their eyes?
Well, without your eyes, you can't do anything, right?
Correct.
So your eyes is like the window of everything. So it depends on your work, whether you're a teacher, you're a reporter, you're a camera guy, anything you need to take care of your eyes. Basic necessities like wearing sunshade, using regular artificial tears, a general annual checkup just to make sure everything is fine, whether you don't have any family history of any eye problem.
And I'm glad
It
that
is
you
needed.
mentioned that, because a lot of persons usually wait until there's an issue before they do
Exactly.
that checkup. And so it is
Exactly.
very, very important that they, do routine screening.
Also do if necessary eye protective gear that is needed depending on your work site, that is needed as well, among others. But as we go in detail, we can talk more about it.
Wonderful. Thank you so much, Dr. Kanai. We will go into a short break and be right back with more on vision and eye care.
Look at this. Do you know how I stay fit and healthy? I ensure I eat right. Win at life. Eat right. Fill your plate with fruits and vegetables, a quarter with protein and a quarter with whole grains. Eat right.
There are many types of glaucoma. Babies can be born with glaucoma, teenagers can get glaucoma, young adults can get glaucoma, but it is usually associated with people over the age of 40. There are many causes of glaucoma, but the most common type of glaucoma, we don't really know what causes it. In those people, they usually do not know that they have glaucoma, and that's why a periodic eye examination is extremely important, because people don't know they have glaucoma until it's very late in the disease. Glaucoma is usually associated with high pressure in the eye, which causes changes at the back of the eye, the optic nerve, which can lead to loss of vision and ultimately blindness. It's a very, very significant disease, and it's very widespread. I'm with Mount Sinai Doctors. If you have any questions or need further information, please feel free to make an appointment.
Welcome back to the program. For those persons who have just joined us, today we're talking about vision and eye care. Can you highlight the various levels of eye care?
All right, so what we do normally, even at the eye clinic, when patients come, they first go to everyone say they go into the eye specialist, which is where they do glasses, so they refer that. Some people don't realize the importance that not only that they need to check for glasses, but also they need to check the eyes.
Yes.
Right? So they first go there. Now the optometrist there, they're responsible of examining the eye to see if there's any abnormal finding whatsoever. If they do find that, they refer them to us. Now when they do come at the hospital, they will be normally see with the general practitioners. Then if they find again, and if there's any abnormal finding, they would refer for the specialist to be seen. Depending on what they have, we decide what is the management of that patient, if they need medical treatment or if it's a surgical treatment. So basically, that's how it goes from those stages.
What are the most prevalent cases of eye diseases found in Guyana?
Well, everyone knows cataract, right? So cataract is one. You have glaucoma, you have diabetic retinopathy, which is diabetic damage or changes at the back of the eye from diabetes. You have refractive error, meaning just that you need pure glasses only. Basically, and what we are finding also is a lot of dry eyes.
Dry.
Because people tend to be a lot on their phones, computer, and when you're on the phone, you forget to do this, right? So you just stare at the phone all the time, and that tends to dry the eyes. Apart from that, we're in a tropical country. The heat, all of that tend to dry the eyes, so we tend to go into the AC more. The AC all of that tend to dry the eyes.
So for persons who may have dry eyes, what can they do?
Normally, if it's just dry eyes, they could use over-the-counter drops, but normally it's best to be prescribed by an ophthalmologist, not go and just buy regular eye drops. But there's artificial tears that you could normally use to help that to relieve that.
Okay. For glaucoma and cataract, Dr. Hines, could you tell us what are some of the risk factors for this, for persons developing these two diseases?
Well, cataract can occur at any stage in life. So in terms of risk factors, let's say in a baby, certain infections that the mom can pass on to the baby can result in what we call congenital cataract. But as we get older, things like trauma on the work site, if you were to sustain an injury during an accident or a fight, we see a lot of those. But yes, that's one way you can develop traumatic cataract. And then of course there's the more common type or the more typical type, which is senile cataract, which is what we'll all get as we grow older. Yes. So risk factors, would be things like infections, disease, trauma, using steroid eye drops indiscriminately that can provoke formation of cataracts prematurely, right? But like I said, it's a natural part of the aging process. We'll all get cataract as we get older, but based on the stage, based on our general health and our genetic predisposition, we may develop it earlier or later based on that. Glaucoma, we know, is a big one because glaucoma results in blindness, incurable blindness if it's not detected early. So risk factors for glaucoma, I'd find that would be after a certain age, let's say after 50, people 50 and up, of African descent. Certain types of glaucoma are more prevalent in patients of Asian descent. Not doing timely eye screening. So you've never had a checkup and then you show up at age 75 and then you realize, all right, so you've had glaucoma all these years. So, so those are some of the main risk factors. We find that patients, of course, if you're doing regular screening, these are things we can catch early. Right? Definitely glaucoma is one we advocate for early screening as early as possible. So if you're doing a regular checkup, a yearly checkup, like Dr. Kanai said, we'll catch that early. So you won't it won't be a surprise that, like I said, at 77 when your sight is totally failing. If we could catch it early and start treatment early, we could reduce severe vision loss.
Definitely. What treatment is available for glaucoma?
Glaucoma treatment is usually targeted at the eye pressure. What we try to do is reduce the eye pressure. So there are eye drops on the market, many eye drops. So based on the type of glaucoma and other mitigating circumstances, we can prescribe eye drops initially. And then there is, of course, laser treatment. The laser treatment is also targeted at reducing the eye pressure. Certain parts of the eyes may be blocked, so we try to open up those channels to get the eye fluid flowing. And surgery too has the same objective, getting that fluid out.
Okay, for many of these eye diseases that you guys would have mentioned, is there any symptoms before they develop fully? Is it possible for persons to experience no symptoms at all?
Yeah, that's the tricky thing, especially with glaucoma. There are no initial signs, so it's usually asymptomatic for many years up until end stage, where that's when you start realizing, wait, I'm not seeing, and by then the glaucoma is already closed in on you. So that's again why we advocate for early screening, because you may have absolutely nothing wrong with your vision. You're seeing 20/20 straight down the middle, but the trick about glaucoma is that it starts stealing your peripheral vision, so it closes in on you.
What can be done? Could treatment help persons at that stage?
Unfortunately, no. Usually at those stages, treatment is geared at not losing the little that you do have. So unfortunately, when it gets to that stage, they haven't discovered anything that can regenerate that nerve tissue that's lost.
Wow. So early screening is definitely important. we do encourage persons to not just screen when there's an issue, but ensure that you do routine screening on a
Yes.
yearly basis. Could you tell us about some of the services, how persons can access screening services at GPHC?
So in terms, but based on the disease, right? But if you just want a basic general checkup, we usually advise that you first go to your health center or or your neighborhood optical or any optical, or we also have the vision center at GPHC. You can access any of those services and you'll get a general screening. If they find anything specific, they would refer you to the tertiary institution, which is the Georgetown Hospital. Additionally, for things like diabetic retinopathy, there's a direct screening clinic for that. There's a phone number that you can probably share, and patients call in, make an appointment, and you go directly there. You get pictures taken of the back of the eyes, and that's funneled through your doctor, and then we can decide if you need any additional treatment. But yes, for basic things, for glasses, I personally advocate for kids getting screened as early as possible. Just have them do a general checkup. It's not very complicated. It's not scary. It's just a quick peek into the eye. We put the little glasses on your, the big thing that looks like something from outer space. We put that on your face. We check, do you need glasses? Do you need eye drops? Do you need anything else? We can initiate that early. So the quicker you get it done.
Especially now in our society that has gadgets. Gadgets is the going thing now. So from the 1-year-old tablet, phone, so that's important because there's a lot of children that we notice are turning, you call it myopia or short-sighted, which is result from the prolonged use of the gadgets that is now.
Yeah, and they're on the screen for a long time, and then there's the blue light filter.
Correct.
For parents who have toddlers and children using tablets and so on, what would be your advice to them?
Well, I don't know if you guys ever heard about the 20-20-20 rule. So after every 20 minutes, take a 20-second break and look at an object 20 feet away. It tends to relax the eye and tend to accommodate the eye back again. So don't leave a child to spend 3 hours on the tablet or on the phone whatsoever at one time. Let them take a break, let them go and kick a ball or something. Something to get their mind a bit off of it.
Definitely, and we also have to cater for the younger population, the teenagers and so on. I know many persons are not so open to wearing glasses, but I know it might be the best thing for some in a particular season of their life. What would be your advice to those persons who are not so open to getting their eyes checked because they're afraid that they might have to get glasses?
Well, let's put it in this way. If you're hungry, you go and eat. If you feel cold, you cover up. Same if you can't see properly, it's advisable that you wear your glasses. Especially for teenagers, there's some refractive errors that it can be eliminated as they grow old. It can help to get their eyes better, put it in that sense. But there's nothing wrong in using glasses. You need your eyesight to do your schoolwork. You need to see properly. You understand? So we would advise at least to wear it.
Definitely. Taking the workplace into context, what can workplaces do to ensure that their staff, they have good vision and they take care of their eyes? What can workplaces do to jump on board with loving your eyes, that theme?
Yes, so since the theme this year, it's a running theme, right? Love your eyes. And this year they want to focus on eye care in the workplace. So we have different workplaces, right? There are factories, business offices, staff rooms, schools. People are working in different environments. So each environment, I figure the onus would be on those in charge to come up with strategies to help based on their specific environment. So let's say a factory, for example, you'd expect the managers to put systems in place so that there's protective gear available. There's signs, clearly marked signs against, let's say, chemical contamination of the eyes and fumes or anything that can get into the eyes. And of course, it's physical damage, right? If you're a cane cutter, You can't be slashing at stuff, because we do see a lot of people with, you know, that cane suit getting into the
Yes.
eyes. It's very difficult to get out. So protective gear for things like that. Let's say you're in a classroom, we go, like we mentioned, we're getting computer literate, all of us, computers and tablets. So definitely limit screen time. You can't be staring at a screen all the time. The way that certain desks and chairs are made, they want us to be on certain, let's say, company workers to have ergonomic seating, so that, you know, you're not slouched over onto the screen. That creates kinks in the necks, eye pain, strain. Digital eye strain is a real condition where, you know, you're fixated there, your eye gets stuck in that spasm and it hurts. So having the computer at a particular level. So all of these things, we'd advocate for different levels of care on those levels. If you're in a very cold AC environment, have people checked out for dry eyes if they're complaining. And I think the percentages show that, like, let's just say it's about 20 or 22% of your productivity drops if your workers are not seeing well. So that would be a good thing to implement. Make sure everybody is seeing you, get more work done. It's more
Definitely.
productive. So
Thank you so much, Dr. Hines and Dr. Kanai.
As an athlete, I ensure I always stay hydrated. I stay away from alcohol, since it affects my performance in the game. I do not smoke. Are you watching what you drink? And if you are smoking, you can seek help to quit both.
Cataract surgery is the only treatment for cataracts, which is a very common condition causing clouding of the natural lens of the eye. What we do during the surgery is remove the lens, the natural lens of the eye, through a very small 2mm incision and replace it with a brand new artificial lens that sits in the same physiological location where the previous lens used to be. This surgery is efficient and it restores the vision to what it was prior to the onset of the cataract. Now, there have been recent advancements in the cataract surgery, specifically laser-assisted cataract surgery. During this process, we replace certain steps performed by microsurgical instruments with laser. That makes the surgery even more efficient and decreases surgical time. Recently, we've also have had an expansion of the intraocular implants, which is the lens that we put inside the eye. The lenses that we now offer have a wide range of prescriptions that they're able to correct, ranging from astigmatism, as well as what we call extended depth of focus lenses that offer correction of the wide range of refractive errors, including presbyopia.
Thank you for staying tuned with us. I'm Alicia Martin saying goodbye for now.